I'm Christine Waller. I am one of the trauma critical care physicians at Gunderson Health System, and I am also working with the sepsis team. I am one of the sepsis MD champions, and today we have a great opportunity to share a patient story, and I am happy to welcome Tiffany to join us.
My name's Tiffany. I'm a registered nurse that works for Gunderson. I've been in family medicine for about 3.5 years now, so I really enjoy working for this organization in particular. It's amazing, so happy to meet with you today.
Thank you. Thank you for coming forward and sharing your story. Tiffany and I have had the opportunity to talk ahead of time, and Tiffany has a personal story about sepsis and septic shock and also has a caretaker view. And I believe as a caretaker it's extremely important for each of us to personally hear your story, hear where we have failed, where we've had our successes, and how we can improve for the future in taking care of our patients. So I really appreciate you sharing your story with us today.
Thank you. So I was actually really impressed with the education that you guys were providing just to the ancillary staff about sepsis, because I thought that was a really important aspect that we're seeing that education as nurses. It is an easy thing to get into your day-to-day work, and having those little reminders or little blurbs of education to kind of pop up and remind us like, hey, this is an important subject that we should be watching for. So that's kind of why I initially reached out to you in the first place, because I thought it was awesome that we were doing that. And so that's how this all kind of started. But, you know, basically my story started in 2016. I was just graduating from nursing school. I passed my NCLEX on the 8th of January. I was so excited. And so it kind of was more of like a celebration night, really. I went out with 3 of my nursing friends just to celebrate that we all passed our NCLEX, and it wasn't a late night because back then I was still tired from nursing school. So we got home pretty early, like 10:30, and I went to bed, normal routine, and my husband actually woke me up at about 1 o'clock in the morning saying I was just shivering. And I was like kind of out of it at first, and I was like, oh, I am shivering. And so for me, I was kind of concerned that there might be something more going on just because my past has been pretty rough in a sense. So I took my temperature, super low grade, 99.3, laid back down in bed just to bundle up and try to maybe calm my body a little bit, because I thought it was kind of cold for Florida. This is in Florida. So we were like in the 60s. So for us, that was freezing. So I was like, oh, maybe I'm just cold. And I realized probably about 30 minutes into that something wasn't feeling right. So I said, you know, I think we should go to the emergency room. So we went to our local emergency room, and when we got there, you know, I'm not allowed to say this word in clinic, but it wasn't busy at all. So I was like, oh, sweet, they can get right in.
It's a bad word.
Yes, very bad word. So when I got back, you know, the normal process, triage, nurse first, and then they bring you back and you meet with the provider. And so kind of a normal routine. And when I got back there, I was explaining to him my past medical history, which is pretty significant. I've had sepsis 4 times prior to this episode. All the same streptococcus pneumonia. It just comes on suddenly. There's no clinical presentation prior to it. It just kind of appears itself. So to me, this was a little different because I had chills and a low-grade fever. There wasn't anything, you know, I thought maybe it was just a normal illness. So I was just getting it checked out just to be on the safe side. The provider that night, first comment was that the flu is rampant right now. So I felt like going into it that this was kind of what he was going to look for was flu-related symptoms. So we did like a normal workup. And I actually said to him, can we please do blood cultures? And he's like, well, this is a viral presentation. I don't think we need blood cultures. And I said, well, with my past, like I usually get sick and I get sick fast. So I would just like blood cultures for my own, you know, make sure. I said it takes a long time for them to come back. So I know I have to wait, but I would like them. So he agreed to doing the blood cultures and everything. And just the normal routine, gave me some Tylenol for my low-grade fever, kind of waited it out. Well, during the time that all this was happening, my brain was just going crazy because I've had so many of these episodes, and I kind of had that, like, they call it like the doom feeling, like this is not right, something's wrong. So that was where I was at during this. And it didn't feel like he was quite understanding that that's how I was feeling. So trying to explain to him, my presentation might seem like a viral infection, but when I get sick, it's instant. And so I just want you to make sure that we're crossing all the T's, dotting all the I's. And so when my lab work came back, I actually felt a little bit of relief because it didn't seem awful. My white blood cell count was on the low end of normal, and my neutrophils were a little high, but viral. We also had a little bit of elevation in like my ALT, AST. So for me, that was significant because of my history. It's usually my liver and my kidneys go first every time. So I said, that's a little concerning to me. And he explained that flu-like symptoms, viral infections can cause some of that elevation because your liver's working harder. I've had a splenectomy in the past, so my liver's doing extra work, which all made sense. And so I was like, okay, well, the flu swab was negative. And then he explained how there's different strains of flu that is not always tested, and just kind of explained that process to me. And I was like, yep, I understand that. I said, but I still don't feel right. And I guess the hardest part for me looking back as a patient is I knew that I didn't feel right. And I was trying to portray that to him, but it was almost like he's convinced at this point that it's viral and that there's not anything further he can do for me that day. So I asked him a few more questions just about my vitals. So in the meantime, they had given me Tylenol with the fever. Well, my fever spiked to 102.7. And I said, I don't get a fever. With the Tylenol. I said, I don't get a fever unless I'm sick. Like, this is me. Again, went into the explanation about the flu and how the flu is really hard on the body, and my fatigue and my muscle aches and everything that I'm feeling is very clinically the flu. So I finally just stopped fighting him and said, okay, well, I guess if it gets worse, I'll be back. And so I did come back 24 hours later. And at this point...
How was your husband feeling during this time? Because he was with you, right?
Yes. He was very anxious. Unfortunately, he had seen me sick prior to this, and so he knew that when I get sick, it can be very bad very quickly. So at this point in time, he wasn't asking a lot of questions. He was more just like focused on me and seeing how I was feeling, and he was kind of letting me do all the talking. So he got home, and he actually had to work that day. The next morning, and he's a fireman, so he was working 4 hours away in Georgia. He actually got there, and they were able to find someone else to come in for him so he could come home. So he came home about midway through the day to just kind of keep an eye on me. I obviously was very tired, and I'm the type that does not call in sick to work. Well, I had to work that day. I was actually volunteering at a center, and so I thought that I was feeling well enough to go in. I got up, got dressed, went in, and by the time I got there, I realized like I'm way too weak to be here. And so my coworker actually drove me home, and I went back to bed. So fast forward probably about 5 hours is when I had the urge to go to the bathroom, and when I stood up, I didn't have control of my bowels. So then I was like, oh, this is bad, literally. So coming back to the hospital, I'm in a panic in my head that I know this is not good. This is not normal. There's something wrong. I'm so fatigued, I can't stand. Like, I had to be pushed inside in a wheelchair. Luckily, again, it was not busy. which was great.
And you went back to the same
Same facility.
Okay.
Yeah. Just because I knew I was there the night before, they had all my labs. They would know what happened yesterday. They would be able to compare to today. So I wanted to keep it, same place, even though I didn't feel like he listened to me and I didn't feel like he was understanding what I was trying to portray to him. But I knew that from this side of things, it's better to be in the same place so they have that comparison and not have to get the records. So that's why I went back. So the triage nurse this time literally said, we need to get you back there right now. So he wheels me back, and I remember him saying to the staff that were kind of at the nurse's station, she's got 4 of the 5 signs of sepsis.
So the nurse said this?
The nurse said this.
Was that like a triage nurse?
It's a triage nurse. Okay. Yep. So that will always stick in my head. 4 of the 5 signs. So, and at the time I didn't really know what those were. I had an idea because of nursing school and passing my boards, but it wasn't like prevalent in my mind at that time, like what he was referring to. So they got me into a room, and that was when I knew that like this wasn't going to end very well, because the nurse that was behind the station said, oh, she was here last night. So that was like, nope, we've already dealt with her. And I was like, okay, this is not going to be good. So at this point, my blood pressure was 50/30. I was probably 140s with my pulse. I can't remember what my respirations were, but they were at least in the 40s. I was not in a very good condition by the time I got back. And I remember like trying to stay like focused and aware of what was going on around me, so that when they would come in, I could like say something to them and talk to them and say like, I'm very sick. Like I remember thinking that, but I was just like falling asleep and waking up and like just kind of getting little blurbs of stuff that was happening around me. So then once they finally realized, oh, she's crashing fast, then they kind of treated me as a septic patient. So
how long a time interval was it from the?
Well,
guessing,
looking
I know
back
you know.
at the
Looking
records,
back, yes.
It was 3 hours before they initiated sepsis protocols. I had been there for 3 hours, so it was quite a extensive time.
So any IV fluids or any?
Yeah, they had me. They started me on IV fluids, ran labs. I can't remember the time frame of when I first got back to that room and when they actually started doing all that work. But I do remember the same doctor was on from the night before, and he walked in and he said, wow, you really crashed fast. And I was like, yep, I do. Tried to warn you. So at that point, it was scrambling to try to figure out what was causing this. And I'm over here in the corner yelling, Streptococcus pneumonia, it's causing it. That's what it is every time. And so they started me on vancomycin and Rocephin because that was my past treatments. They got me on the fluids. They gave me vasopressors to try to get my blood pressure up. Before all of that, I started having symptoms of, lack of blood flow. My feet were very cold. They became very painful. Just somebody walking by, the air hitting my feet was like excruciating pain. And so that was my biggest complaint the whole time I was there. Out of everything, I was like, my feet hurt, my feet hurt, my feet hurt. So looking back, that's because I was pretty much going into DIC, so I was clotting off. But from my standpoint, at the time, I guess I was just happy that they were doing something. I felt relieved that I was there, and I was like, okay, I have a chance. I'm here. They're giving me stuff. Like, they got the antibiotic going. Like, let me just survive this. Like, that was what was going through my head. My husband, I don't really remember much. He's kind of the quiet kind that sits in the corner, like, let me get out of your way and do what you need to do, but fix her right now kind of guy. So.
And he has some background being a firefighter, so
yeah.
he knew that you were an extremist.
Yeah. Yeah, so he understood what was happening, maybe not to a full extent, but he knew that what was happening was bad. So got me to ICU pretty quickly after they initiated the protocols. And the ICU, I don't remember much of it. I remember meeting with the vascular surgeon. I remember meeting with the hematologist. I remember more than I should have ever been able to remember. But I think I was just like, I want to know what's going on. Like, that part of me was like, I need to know what my labs are. I want to know where we are. What are we doing? So I think having that actually is what helped me get through and survive this, because I was so determined to know what was happening. So my type A personality, I needed to know. So that is kind of what it kept me going. And so once things started to improve and I realized how bad things were, was when kind of the emotional side came in. Like,
how many days were you into your illness at that point?
So the 14th, I was admitted to ICU, and the 17th, they transferred me to a higher tertiary hospital.
Okay.
So that point, I was more aware. I was, 2 days of antibiotics and, just lots of treatment going on behind the scenes. So they got me to the ICU in Orlando, Florida. And at that point, I knew now, like, okay, I was in DIC. Streptococcus pneumonia was the culprit. I had severe pneumonia at this point. Again, my biggest complaint was how bad my feet were hurting. And so they pretty much said we should keep you in ICU for several days while we're trying to kind of figure out what we can do to regain circulation to your feet. So that was when I was like frustrated. Like, if he would have just listened to me, if he would have listened to what I said and how I crash fast and how if I have a fever, these things are not good for me. I know my body. I know that this was going to lead to this. So that was kind of where it all kind of came back, and I was a little angry, I guess, in a sense.
Understandably.
Yeah. So.
And you don't have a spleen.
I
so
don't.
That there were key things that you were telling the physician right from the beginning that were missed.
Yeah. So it was very enlightening too. I mean, now I know every sign of sepsis, and it's kind of like,
you can help us teach others.
Yes. I was like, I'm the type of person that if something happens like that, where I want to know everything about it so that I can prevent it from happening again. I want to look at it. I want to take the bad and turn it into something positive. So for me, it was more of, at that point, I knew what happened, and I just needed to move forward. And so I knew that there was not going to be circulation regained to my left leg, so they were going to have to amputate. The hardest part of that was I had such severe pneumonia that they couldn't put me under. So I had to wait, I think it was 23 days before they could do the amputation. So watching the progression of my foot being white to turning purple to turning black to the skin shriveling to the extreme amounts, I guess I would describe it as like neuropathy. It was just constant pain, tingling, burning sensations. And then those evil PT people that try to make you walk.
While you were having that, they still were trying to make you walk.
Because they were hoping that getting everything going would help my right foot.
Be able to save your right leg.
Yeah. Okay. So I used a walker. I wasn't just trying to walk. But so just having that and seeing how that happened and watching that timeline unfold, and it just made me very passionate about sharing my story, because it shouldn't have happened, but it did. And so I like to make sure people know that we have to listen.
If you could go back and talk to that provider today, and maybe you have.
I have not.
Yeah. If you could go back and talk to that provider today, or even if you observed another provider that may have had the same bedside manner and thought process, what message would you give that provider?
My message would be that we get into these day-to-day routines. I can't imagine what the ER physicians see on a day-to-day basis. I know that it's not a simple job either, but I feel like assumptions are made from the beginning of the patient coming in just by what the vitals look like when they present, what the tests look like. And there's cases like me who have this significant medical history. And I feel like I'm a more rare case, like there should have been more paying attention to what was happening in my case because of my past medical history. But there's still patients out there who don't have a history like mine that go septic. And so keeping in the back of your head that this patient is telling you that they don't feel right. I mean, that impending doom is a real thing. I never really thought of it as a real thing up until the point that I felt it. And so listening to the patient tell you there's something wrong, there's something wrong, there's something wrong, and taking that and saying, okay, well, let's look at it in a broader sense and not just narrow in on what we think it is. That would be my only message that I could share.
That's a powerful message. Treat each individual person.
Mm-hmm. Yeah, exactly. You know, we're all individuals. We all have different ways that we present. Everybody's body responds differently. You know, just don't have an assumption that that's what it is and treat it as that's what it is without looking a little bit further into it. So.
And what would you tell the general public or a patient that comes in? What message would you try to give them?
My message for patients, especially dealing with a family medicine type of world, we see a lot of things too. And so my message to patients are, when you feel like something is wrong and you feel like things aren't being looked into on a deeper level and you're not improving, don't be afraid to ask for more. You know, fight for that care, because sometimes we have to advocate for ourselves. It's nice that we have nursing staff and even providers that advocate for their patients, but we need to make sure we're advocates for ourselves and that we don't just fully rely on the medical providers to be our advocate. So that's kind of where I push patients. If this does not feel right, just make sure you push that message and ask for the care that you think that you are deserving and needing at that moment in time.
That's a huge message, especially the spans of patients as you see, empowering the patient to say, please say something.
Mm-hmm. Yeah. And I like to educate people in general about their own health care. You know, sometimes patients don't understand the full extent of what their comorbidities are and what these things can do and what they relate to. And so I really like to make patients responsible for their care too. I think that in a family medicine setting that we have the opportunity to educate them, we have the opportunity to teach them what their diagnosis means and ask for things when they know they're not right, because it's a great platform for education. So that's where my passion is.
That's a great passion, being able to connect also with other people. Have you connected with sepsis patients that may have also lost an extremity or have?
Yeah, so
that's a really personal question.
Yeah, no, that's okay. A lot of what I'm finding as far as amputees go is I've found quite a few sepsis amputees. With the way social media is this day, people reach out to you and I'm able to reach out to people. And so we have kind of like our own little world. We have an amputee world that we can share how we're feeling, where we share like what our new leg looks like, what we can do with this new leg. And so the sepsis patients are unique because there's a lot of different things that go into it. The emotional parts of it, not having control. You know, I'm a type A personality. I like to have control. I like to know what's happening.
Most of us in healthcare are type A personalities.
So not having the control to like direct your care, even if I wasn't a healthcare provider, it's hard to know that there wasn't more that you could do for yourself to keep that from happening. So it's nice to be able to reach out to those people, share our stories together, and empower each other that, what has happened. Let's just show the world that we can move past this and we can do better and we can educate. So I kind of love social media and that platform because we really have a chance to make the public aware of it, not just healthcare aware of it.
Right. Knowledge is power, being able to share that.
Mm-hmm.
And your story is absolutely phenomenal. How did your husband, this is a lot of emotional to go through, watching you so sick that you lose an extremity, and also knowing that you weren't listened to the first time, knowing that you don't have a spleen and you normally get strep pneumo, and you were saying what was going on.
I think the biggest part for him, which I didn't mention when I first told my story, is before we left the hospital, I actually basically begged him to give me vancomycin and Rocephin, and I said that this has been my first line treatment. They've always given it to me while we wait for the blood cultures to come back. And he basically gave me the spiel about how antibiotics are becoming resistant and that we shouldn't treat viral infections with antibiotics. And so that was his he was stuck on that I was requesting the antibiotics. I was asking for something that would have maybe prevented it going so far. It's hard to tell, but having that intervention early would have certainly helped. So his emotions go back to not even the not listening about my medical history, just she was asking for what she needed, and you just said no. Mm-hmm. And so that's where he gets stuck. He's doing very well, though. We have lots of jokes in my family about, we go grab my leg, can you take my leg off? We pull my pants down. So it's been nice because I have 2 children at home too. So they experienced all this, and seeing me lose my leg and seeing the rehabilitation part of it. And so it's a family thing. So they've really all pitched in to help me. So he's doing much better. At first, it was an emotional roller coaster of anger, of betrayal, of working in a healthcare field as an EMT and fireman. It was emotional for us, but we've all kind of moved past that, and I threatened to throw my leg if I need to.
How old were your children when all this happened?
9 and 7.
Wow. Mm-hmm. To watch their mom be so sick that she goes into septic shock, requiring NCU, and then loses her leg. That's
all after I graduated nursing school. I was like, at least I made it through before this happened. But yeah, it was crazy. When I look back on it now, I'm so thankful that the second presentation, even though things were delayed, that I had that willpower and that drive to keep myself going long enough to be able to get the treatments that I needed. And I really think that I tell people all the time, mind over matter, like your brain is a powerful thing. Like you can use it. If you believe that your treatment will work, if you believe that you can rehabilitate yourself, if you don't focus on the negative part of it and you look at the positive part of it, you can accomplish it. It's just a matter of believing in yourself and doing it. So that's just kind of where I go back to, is you can do it. You just have to want it. So,
well, thank you so much.
You're welcome. So when I saw this, I was just excited. I was excited that we are, as an organization in general, Gunderson has a really good face in medicine. I feel like our collaboration with other departments, our ability to share, our regional departments, how connected we are to the main campus, and how we can utilize all these resources is so awesome. Coming from Florida is completely different. Florida is a lot of independent physicians, a lot of independently owned hospitals. There's not this connection with the physicians and the hospitalists. It's kind of all separated when it comes to healthcare. And if I could go back and change that, I would in a heartbeat. Because working here, I see like how connected we are, how many resources we have. The Gladiator, just being able to access all that is just amazing. And so I feel like if I was in Wisconsin, this would not have happened, unfortunately. But I got brought here for a reason, so.
That's exactly right. We're happy you're here.
But yeah, so it's been interesting to see the different sides of healthcare in different states, and just knowing that we really have a great organization here. It's amazing. And the work you guys are doing to like educate even just outside communities. I like how like UW works with us, Mayo works with us. We have the VA that's working with us. There's so much collaboration that we can be amazing when it comes to healthcare. We just have to make sure we're doing it the right way.
Right. And we still have to continue to learn and continue to educate and go forward.
Especially with this rapid changing healthcare world that we have.
All the time. Yeah.
I feel like I'm really good at like de-escalation. That's kind of what they use me for a lot. Just talking with people, evaluating where they are and where they're feeling. And I kind of look back at some of the education that we got about motivational interviewing and ways that we can look at a patient and say, okay, this is where they're at. We need to meet them where they're at and then bring them to our side.
Right.
Not meet them full force with just, nope, that's not how this is. So I kind of get used a lot for situations like that, which I'm happy to do because I enjoy like taking a patient that's ready to blow up on everybody and bringing them back to, we're here for you. We want to be here for you. Let us be here for you. But these are the things you have to do yourself to let us do this for you.
You have strong emotional intelligence too.
Yeah.
That's really great.
Yeah. So it's been nice. I think that all these things that have happened have just built me to be a good nurse and to be able to, use my abilities where I need them. But they always tell people, watch out, she'll throw her leg at you. I'm like, really, Dr. Hodgson? Don't tell them that. It's a great distraction tool for kids, too. Oh, I use it all the time. Like, they'll be in lab trying to hold them down, and I'll be like, you want to see something cool? And it's like, perfect. It just completely distracts them.
Their face probably drops.
They're like, oh, she's a robot. That's what I get. Mom, that's that robot lady. I love it. So it's really neat.
Wow.
But, yeah.
I'm just amazed by your sense of willing to help other people and that you're not angry and you're wanting to make sure to share their message. I mean, that you could easily see where someone would hold on, like you said, to that anger or that frustration or that feeling of I can't do this anymore because I've been dealt this, and you have turned everything into a positive.
Yeah. And I mean, obviously everything's an emotional roller coaster. We have those moments where that anger wells up and you just are so mad, but I always try to bring myself back to, this is why I'm doing what I'm doing. Like, this is my purpose. Don't take it and let it waste. Like, so it's, the most frustrating part is we don't have a lot of resources for disabled people, like in the community. I mean, really, we don't. It's not a cheap thing. I mean, legs are very expensive. Having a shower chair and a stair chair and things to accommodate your house to fit to what you need is like a nightmare. Like, if I couldn't wear my leg and I needed to do dishes from my sink, I'm standing on one foot, So being where I am and seeing that and seeing our other patients that we care for, and like, I try to work with our care coordinator just to say, like, these are the things that they're gonna need. Like, let's pre-plan for these things so that we can have them taken care of before they get home. Because once you're there, then you realize, like, how do I move around my house? Like, how do I get upstairs? How do I get in the tub? Like, so it's a lot of emotions from an amputee perspective. So it was a lot to deal with at first, but I can't hop around anymore because I have multifocal osteonecrosis. When I first became an amputee, I was kind of, hopping around to do what I needed to do. But then when they discovered the osteonecrosis and how severe it was, wheelchair and then getting the boot. And now I have this really fancy orthotic. So it works just like a boot.
Oh, okay.
But it's an orthotic. So it has a foot plate that goes all the way to my toes to help keep me from having so much pain. But it's just interesting, like how we look at them and say, oh, this is what we're going to take care of, but there's so many other things that are being missed on the backside of when they get home.
I can even think of patients when you're sitting there showing me that the whole taking care. You're right. We take care of the medical aspect and we'll often focus, okay, here's your brace, here you go. But we're not actually taking care of the complete person because we may leave out the emotional aspect, the physical aspect of being at home. Are they actually getting food once they get home if they can't get around? How are they doing their daily activities? And I think all of that is probably lost.
Yeah. And I could agree with that a little bit. I think we do a good job of making sure things are in place for them when they leave. I think Gunderson does follow up with primary care if there's orthopedics or, you need to go see this doctor, this doctor, this doctor. We try to make sure that's all in place, which is great. But, there's days where you're in so much pain that I don't care about that appointment. I don't want to go to that appointment because I just want to sit here because I cannot move. And if I move, I'm going to have a mental breakdown, Right. So it's kind of like thinking of those things. And I think our care coordinators are awesome. But they're overwhelmed too. They can't take care of every patient that discharges. Right. But I just think focusing on some of those patients with these severe things, like losing a leg, and just keeping that in mind that we need to close that loop and make sure that they truly are cared for at home. Because they asked me questions like, do you have stairs at home? No, not at the time. Do you have, I don't know, how wide is your bathroom doors? Don't know. You want to go measure them for me? I don't know any of this information. I didn't come here prepared for this. So when I got home, I realized, crap, I do have stairs. I have a little stair and then a big stair to get into my house. And that wasn't even something I thought of because I didn't have traditional stairs, So just trying to figure out how to get up with one leg and a walker to get inside was I sat there for a minute okay, I'm a nurse. I can figure this out. What did they teach us about body mechanics? But for a patient who doesn't have that experience, I can't imagine what they feel and what they're thinking and what they can do for themselves without having somebody direct them on it. So, yeah. I could go on all day, so you should probably cut me off.
Well, your story is just phenomenal. It is completely overwhelming to me. I could keep asking questions too, because I think what the really big take-home message for me is that even in 2016, this 2016, with all of our medical opportunities, all of our treatments that we can offer, it still comes down to sepsis, septic shock, and loss of an extremity. And we saw the same type of illnesses 100 years ago.
Yeah.
And early intervention 100 years ago was key in letting those people survive. And early intervention today, in 2016 or 2020, is the same thing. So how much advancements have we made where sepsis and septic shock are concerned? It's the exact same treatment. We're trying to do better as far as getting that initiative going.
Absolutely. And I think one thing that I've heard feedback from my providers in the clinic from patients that we see is they keep that in mind more because I'm an example. They have that in the back of their head when they're treating this elderly patient or this 6-year-old. And their presentation is odd where they are feeling sicker than what they look. When it comes to lab results and it comes to clinical presentation, but they are feeling way worse than what the labs are telling them. And I think even just that little hint of, okay, this patient's saying this is how bad they feel, but this is what it looks like, just keeping it in mind, run a lactic acid, you know?
Right.
Just see what it's doing. You know, it's not gonna, yes, it's one more test, it's one more health expense, and we're all about trying to reduce the cost of healthcare, but there are cases where you could have done that and seen a little hint of what was happening. So I push it sometimes when I have that gut feeling that this patient is very sick, and I will say, what about doing this? And they're like, I didn't think of that. I'm like, okay, let's do it. So, and actually, believe it or not, I think since I've started here, we've had 3 sepsis patients.
Really?
That I triaged on the phone, got them to the hospital, didn't even bring them to the clinic, just triaged them on the phone and said, you need to go to the hospital right now, you need to get a workup. And 3 of them ended up actually being septic. So it was just, it's nice. It's a nice feeling to like,
you're helping.
Yeah. So I like educating our nurses too. Well, and like looking back now at my records, like, because I reviewed the heck out of my records.
Sure, I would too.
I did. And I looked back, and my fever spiked to 102.7 while I was there. My respirations were 144. My blood pressure when I first came in was like 150s over 70s. By the time I left, it was 98 over 50. I mean, literally everything was there. Like everything was there. And how do you miss that? Like, how do you, and I'm not paying attention when I come in just because I'm a healthcare provider. I'm not there because I want to be a healthcare provider. I'm there because I want to be a patient. Like, I want you to treat me like a patient, not that I have this knowledge base that you can use. I want to just be a patient. I don't want to be a healthcare provider at that point in time. I'm here because I don't know what's wrong.
Well, you shouldn't try to be a healthcare provider at the time. You're the sick one. You need somebody to take care of you.
And so, like, looking back at it, it's like, man, if I would have paid attention to my own vital signs, I would have not left. I would have not left.
Right.